So just about our presentation today, we will be learning about health inequities and disparities in prostate cancer and more from our wonderful researcher, Rana. Benny has an MPH from the University of Saskatchewan, a Master of Science in Kinesiology from the University of Calgary. She's a research assistant right now at the University of Calgary, and we are very grateful to her for coming today and sharing. And without further ado, I will stop my sharing and have her continue with her presentation.
Perfect. Thank you so much. Hi, everyone. Thank you for the introduction, Mayor. My name is Rana, and as mentioned, I currently work as a research assistant for the Departments of Critical Care Medicine and Community Health Sciences at the University of Calgary. And so I do have a really multidisciplinary background, as mentioned, which includes, sciences, public health, epidemiology, and kinesiology. But I've always had an interest in examining disparities in cancer care and cancer outcomes. And so today I'm going to be talking about disparities in prostate cancer. Thank you. So just a little quick overview for today's webinar. I'm going to talk a little bit about my work. I'll give a brief overview of inequities in cancer, specifically looking at the role of race and ethnicities, and then exploring into some studies to recognize the work that's been done, specifically looking at race and ethnicity. So I just a little bit about me. So I've just completed my second master's this past summer, but I really knew early on that I wanted to examine equity, diversity, inclusion, and accessibility when it came to research. So during my first master's, I started working towards addressing health inequities in cancer care. And during my second master's, I actually received the Canadian Graduate Scholarship to start working and starting to address cancer disparities. So before we, start looking at different studies that have been done, I wanted to talk a little bit more about cancer disparities and inequities in cancer. So it's really important to understand the terms. And so the terms cancer disparities and inequities in cancer, they both refer to variations in cancer outcomes among different populations, but they do emphasize slightly different aspects. So when we look at cancer disparities, this is typically referring to measurable differences in like incidence, prevalence, mortality rates, and overall burden of cancer among specific populations. And then when we look at inequities in cancer are more they encompass not only disparities in cancer outcomes, but they're now also looking at the underlying injustices and unfairness in the distribution of resources, opportunities, and the power that contribute to these disparities. And so when we look at cancer disparities, we're often referring to those observable differences in cancer outcomes among populations. But when we look at inequities, we're now diving deeper and looking at that structural systemic factors that drive these disparities. But we're emphasizing the importance of addressing broader social determinants of health to achieve health equity in cancer care and outcomes. So when we look at inequities in cancer, they can stem from many factors. And so some of the factors that we see include refugee status, poverty, socioeconomic status, gender, people with disability, and we also see race and ethnicity. So let's go to the next slide. And so through the research that we've done and just research that's being done in general, we know that there are noticeable differences leading to a disproportionate burden among certain racial and ethnic minority groups. And so just to, for the rest of the presentation, I am going to be talking about race and ethnicity. And so I just wanted to start off with one of the studies that I've been involved on, which was a rapid review that was looking at understanding the role of race and ethnicity in cancer care. So the results from the rapid review determined that race and ethnicity do have an influence on the experiences during a cancer diagnosis. And just to say that the study, so we had started it and we are still working on it. So one of the results is this is what has come out. So when we were looking at the results, there were four themes that had come out, that were identified, and the themes were related to the role of race and ethnicity has an impact on when you're being diagnosed. So having that later diagnosis. There was a lot of stigmatization of cancer diagnosis, depending on, race and ethnicity and belonging to a certain group. And there was also a theme that came out about the cultural influence of communication. So how are we communicating in certain race and ethnicity groups? We don't talk about cancer, and so there was no communication, or just how cancer was being communicated overall in communities had an impact. And then the last theme that came up was family perceptions and expressions of cancer diagnosis. So within families, how one could express themselves after a cancer diagnosis was being impacted depending on the race and ethnicity that one belonged to. We'll go to the next slide. So as I've mentioned, that was one of the studies that we have that we are still doing right now. So we're going to be revising it, and we're going to be making some changes as we go on. But recently I was working on a study that just got published. So we're going to be looking at some other studies that are looking at race and ethnicity in cancer care as well. So the first study here that I wanted to talk about, and this is the one that was just recently published, was we were looking at physical activity behavior change in Black prostate cancer survivors. And so this was a qualitative study where we used the behavior change wheel as the framework to guide the analysis. And so one of the big things to note about the studies that I'm going to be talking about now is that all of these studies were done using American data. So, why did we start the study? Kind of a little bit background. So studies show that racial and ethnic disparities are evident in prostate cancer prevention, testing, treatment, and survivorship. And so although all racial and ethnic groups are affected by prostate cancer, studies show that African American and or Black, and I'll refer to as Black now going forward for the presentation, Black individuals are more likely to be diagnosed with prostate cancer, and they present clinically with advanced stages and experience poor outcomes. And so when we look at different types of treatment, radical prostatectomy is the standard surgical treatment and a common treatment option for controlling prostate cancer progression. But when we compare to like the white peers, Black individuals are treated for prostate cancer, maybe especially more susceptible to urinary, bowel, and physical problems, and experience more difficulties during recovery following radical prostatectomy due to like the healthcare literacy and the lack of access to care. And so it was imperative to develop strategies to increase prostate cancer survivorship among Black individuals who have the potential to benefit the most from engaging in physical activities. And so that's kind of where this paper came up. And we were looking at, because we know that physical activity plays an effective role in mitigating complications for surgical treatments. And overall, it improves the quality of life of individuals post-surgery to prostate cancer. But we know that the body of literature right now, when it comes to reporting benefits of physical activity interventions, especially for individuals diagnosed with prostate cancer, and if it's following treatment, it has been done and conducted on white individuals, but the experiences and perspectives of Black individuals after surgery for prostate cancer are quite lacking, and there wasn't a lot of literature out there. And so this is kind of where we started for this study. It's just the next slide, yeah. And so for this study, the main thing, the main study question and objectives that we were looking at was identifying the barriers and facilitators of physical activity to promote behavior change, and to informing the design of physical activity interventions, applying the behavior change wheel for Black individuals diagnosed with prostate cancer following radical prostatectomy. And so overall, we were understanding the various domains of influencing behavior change and how it's fundamental to promoting engagement in physical activity. So just a little bit about more about the study. So the study was a secondary analysis, which was a secondary analysis of where we have data and we're just looking at the data that was given to us. And so the data was from a focus group that was conducted from the PI study, and PI study is the parent study, and it's short for prostatectomy, incontinence, and erectile dysfunction study. And this is a study that ended in 2014. So we had all of this data available, and that's where the secondary analysis came from. And so the PI study was a prospective cohort study of prostate cancer patients who had underwent a radical prostatectomy. And so when the PI study was happening, there was three 90-minute focus groups, and each focus group had about 3 to 5 participants that was being led by a trained Black male facilitator. The focus groups consisted of 18 open-ended questions that were addressing post-prostatectomy experiences of prostate cancer survivors. And so some of the things that were being discussed was, side effects, patient-provider communication, physical activity, and social support. And so when the original study was happening, the initial qualitative analysis had identified themes, which we'll also be going over. But the themes that came up were, surgical complications and their management, social support. There was, that having that shared prostate cancer experience, the role of physical activity, perception of normalcy, prostate cancer in the Black community, what's the role of the physician, and guidance. So those were some of the themes that were popping up when the original study had just been completed in 2014. But when I was doing my study, when I was doing the secondary analysis, we used the data that was there from the focus groups, and we were utilizing the data on experiences with physical activity, and we were grouping them into barriers and facilitators for physical activity, which was in line with the proposed framework of the behavior change wheel. Just the next slide. Yeah. So what is the behavior change wheel? I've been talking about it a lot. What is it? So let's go to the next slide. So the behavior change wheel, here's just a visual of kind of just to put it all together of what it includes. The behavior change wheel, it includes a combination of the theoretical domains framework and the capability, opportunity, motivation, behavior model, which is also known as the COMP-B model. So within the behavior change wheel, the theoretical domains framework is mapped into these overarching COMP-B model. And it consists of 3 key components necessary for behavior change. And so within the behavior change wheel, we see, you can see, like, if you look at it closely, the green where we have the sources of behavior, we have capability, opportunity, and motivation. And so when we were doing our analysis, we were really focusing on these 3 aspects, and to understand and to categorize our behaviors, our barriers and facilitators. So when we look at this physical and psychological capability, which falls under the capability section there, it was where we're looking at what kind of behavior requires physical and mental skills, knowledge, and strength. So that's kind of what fell under that category there. Then we were looking at opportunity, and opportunity is categorized into physical and social environments. And so this is where we were looking at, concepts such as time, location, resources, and support, and if that had an impact on behavior. And then we have motivation. And so motivation was more of that reflective aspect, where it's looking at the conscious planning, but also just that reflexive process as well. And we were trying to see if in the data that we had, if there was anything that was being referred to as motivation, for example. So the behavior change wheel, it facilitates when it comes to designing and evaluating behavior change interventions. And so what's the good thing about behavior change is that it's all of the frameworks kind of put together in one, and you can see that in the 3 layers here. So the inner layer, as I've mentioned, is the COMP-B model, and it outlines the 3 that I've talked about, which it has capability, opportunity, and motivation towards behavior change. And then the behavior change wheel, it's a hub that recognizes that behavior is a part of an interacting system. So that's why you see the layers. And so the surrounding, the hub is the layer of 9 intervening functions. And then when you look at those functions, you'll see that there's things like policy, for example, that fall under. And so they all kind of fit together, and they're all looking at what we can do for behavior change. So we'll go to the next slide. And so the results from the secondary analysis that I conducted was that we had barriers and facilitators, and we were able to identify them. And the interesting thing that we found was that there was results that were single-coded and double-coded. So I'll just go to the next slide. And just to kind of describe, I'm sorry, I feel like it's a little small here, but what it was meant by single-coded and double-coded was that when we refer to the domains, if it was single-coded, it was only fitting into one domain. So either it was like a capability, or it was an opportunity or a motivation. So it was only fitting into one domain. So this table here just shows examples of, for example, psychological capability. And then in the quotes from the data that we had, we're looking at what could be psychological capability. And we have that highlighted in this table, which can also be found in the manuscript that's been published. Let's go to the next slide. And so this next slide here now shows the difference, and it shows what a double-coded quote looked like. So when we look at this table, again, this table is also available in the manuscript, shows how within the behavior change wheel, there were 2 different domains that could potentially, that quotes were fitting into. So for example, the first little column that we see here, there's psychological capability and physical capability. And you can see which quote fits there. And you can see like the different highlighting or the bolding and the italicizing for the barriers to see which part of the quote represents which domain. And so it was really interesting to see that, this throughout the data, there was single, there was double coded, and we also saw some that were triple coded as well. And so they were representing more than 2 domains there. And so, as I've mentioned, our results did catch that there was more than one domain, meaning that there's some complexity and intersectionality between the domains. And so when it comes to behavior change, we were seeing that, capability, opportunity, and motivation, that there's something between the 3 of them that are connecting them together, and that it's needed for behavior change. And one of the other things that we noticed was that even though when they were double coded, and if they were associated with more than one domain, a lot of them were falling under the group and being categorized as facilitators. So within the single coded domains, we had some that were strictly facilitators for behavior change for physical activity, and some that were strictly barriers. But everything that was coded for double coded, or I wouldn't say everything, I would say majority, they all showed up as facilitators for physical activity and behavior change. And the other thing that we also saw for the results was that motivation was affected by psychological and physical capability. And so that was one of the big things that we had noticed when we were doing the analysis of how things were falling into the domains, what was happening with the data. And so that was one of the things that we had noticed. Just go. So that was those were the results that we had found for that study that had been published. But the same data has been used, or like the studies in the past. And so with the next studies that I'm going to be presenting, I haven't worked on these studies, but they are using the same data, and I have permission to quickly go over them and just to give a quick explanation of what was happening in these studies. So the first one that I wanted to highlight and to bring the attention to was a study by Dr. Lin Yang and her team. And this was a study that was looking at African-American prostate cancer survivorship, and it was exploring the role of social support in the quality of life after radical prostatectomy. And so when we look at the study details for this study, So again, because it was the same study, we had the same population, so it was the PI study. And again, it was the same focus groups that were happening, but it was a qualitative analysis. And so this is where they were looking at the focus group data directly. And then the themes that came out of that study was they were looking at the views of prostate cancer in African American communities. There was also the discussion around perceptions of normalcy after radical prostatectomy and the social support. And then there was also discussion around emotional side effects following radical prostatectomy. And then also looking at social support involvement and the impact during recovery. So that was the first study that was there. Then there was another study that was published using the same data. And this one was the physician role in physical activity for African American males undergoing radical prostatectomy and prostate cancer. So with this study, again, I have the slide just kind of going over the study details. And again, because it was the same population, same group, it was the PI study. They had the same focus group questions and qualitative analysis that had happened to go over. But now the four themes that had come across when we were looking at physician role in physical activity was we saw, actually understanding what is the role of the physician when it comes to prescribing exercise and physical activity. And in this study, there was also discussion around the perceived barriers to physical activity. And then there was also, again, discussion about normalcy and perceptions of normalcy post-surgery and what that looked like. And then the fourth theme was resources for prostate cancer survivors that they seek during the diagnosis and during treatment. So before I go into the take-home messages, these are just some of the studies that I wanted to show and to talk about. For the last two studies, if you have any further questions, you can always reach out to Dr. Lin Yang, who had conducted these studies. So take-home messages from this presentation and looking at health inequities and disparities in cancer is that we need to address health inequity to avoid increasing health disparities. And when we're looking at health inequities, because we're looking at the systemic, this more structural issues that are happening, we have to look at that healthcare system level change that's going to bring more patient engagement when it comes to the care of when someone's diagnosed with cancer, being in the cancer care continuum. And overall, we need more cultural sensitivity throughout the cancer care journey because we've known, and there's a lot of work that's happening right now that shows the differences between different populations and everyone's having different needs throughout the cancer care journey. And so I just wanted to say thank you for having me present on disparities. It was a really quick introduction to disparities in prostate cancer. If you have any questions, you can always email me, but I have also included Dr. Lin Yang's email here as well. So if you have any questions about the work that she's done in the last two studies, and then also a link to her other studies that she's doing on prostate cancer as well.